there are also different lobes when it comes to the thyroid. So what are those lobes?
So in the thyroid gland, we have a right lobe, a left lobe, and a central portion called the isthmus. There's also another little lobe called the pyramidal lobe.
Okay.
But you can live with just half of your thyroid gland just fine.
Really?
Yes.
Now, with these, what is the purpose of the lobes?
They're just an anatomic distinction to distinguish one from the other. So if you had a small nodule in your right lobe, and even if it was a small cancer, a right thyroid lobectomy or removing a little bit less than half the thyroid gland would be adequate for cure of that disease, but sufficient to maintain normal thyroid function in the majority of patients.
You mentioned the parathyroid glands. Let's go a little deeper into them. What purpose do they serve in the thyroid?
Yeah, so the parathyroid glands actually live next to the thyroid glands, and that's why they're called parathyroid, next to the thyroid. They actually have very little to do with the thyroid except that they're neighbors, and they share a common blood supply.
Okay.
But what the parathyroid glands do, another endocrine organ, they produce parathyroid hormone that goes into the blood, it circulates, and it binds to receptors. And when it binds to receptors, it affects the calcium metabolism of the body. Now, calcium is critical for everything. Calcium affects your muscles, your brain, your thinking, your energy levels. It even affects things like depression and insomnia. So calcium is critical, but it's parathyroid hormone behind the scenes regulating this small ion called calcium. But in addition, and we'll talk about it, overproduction of parathyroid hormone can lead to its own set of issues.